stop. Hi, everyone. Good afternoon, and welcome to today's Fireside Chat in honor of Liver Cancer Awareness Month. I'm Amna Hussein, the Community Outreach and Engagement Manager at the Masonic Cancer Center at the University of Minnesota, and I'm excited to be your moderator for today's session. The Fireside Chats are brought to you by the Office of Community Outreach and Engagement, the Masonic Cancer Center at the University of Minnesota. The Office of Community Outreach and Engagement serves as a vital bridge between the Cancer Center and communities across Minnesota and beyond. Our dedicated team is committed to reducing the burden of cancer by actively engaging communities and providing access to relevant knowledge on the latest in cancer research, prevention strategies, the importance of screening and early detection, treatment options, survivorship, and opportunities for clinical research. Today's Fireside Chat will focus on liver cancer, its risk factors, prevention, and the importance of community outreach efforts in liver health. Our speakers will offer key insights into both the clinical aspects of liver cancer and community-driven prevention initiatives. First, we'll hear from Dr. Zamzam Ali, a medical doctor from Somalia with a master's degree in public health for development from the London School of Hygiene and Tropical Medicine. Dr. Ali is dedicated to advancing health equity, early detection of liver cancer, and hepatitis elimination in African communities. She is currently pursuing a PhD in clinical and translational science at Mayo Clinic, where her research focuses on improving access to quality healthcare and developing innovative solutions to address health inequities. Following Dr. Ali, we will hear from Jessica Trinh, a medical student at Mayo Clinic who's currently completing, in addition to being a medical student, she is completing a master's degree in clinical and translational research. Jessica's research focuses on addressing health disparities and has significant experience working with community organizations on liver health awareness and including public service announcements and liver education workshops. She is continuing her liver health education efforts through a fellowship from the National Medical Fellowships and is actually organizing a liver health forum in the Twin Cities on October 26th. So before we begin, we'll just cover a few housekeeping items. Today's Fireside Chat will be recorded as they always are, and we'll post the recording on the Masonic Cancer Center's YouTube page by next week. For all University of Minnesota employees and spouses participating in the University of Minnesota Employee Wellbeing Program, you can earn 200 wellbeing points by completing the form that will be linked in the chat shortly. And then throughout the session today, please use the Q&A feature at the bottom of your Zoom screen to submit any comments or questions that you have throughout the session. And we have time carved at the end with our speakers. So I won't take up any more time. Without further ado, I'm going to pass things over to Dr. Ali. The virtual floor is all yours.
Thank you, Amna, and thanks for the nice introduction. I'll try to share my screen. Please let me know if you can see it.
Yep, it's up and ready.
Perfect. So hi, everyone. My name is Zamzam Ali, and I'm really happy to be with you today to talk a little bit about liver cancer. I would really like to thank the Office of Community Outreach and Engagement in the Masonic Cancer Center of the University of Minnesota for this kind invitation and for all of the effort they are doing, and specifically thanking Amna for organizing things. Starting with our session agenda, today we will try to shortly cover an overview of the liver and the liver cancer, trying to understand what are the common risk factors associated with liver cancer, how is the clinical presentation, and then the diagnosis treatment plan, and finally we'll end with some notes about the prevention. Starting with a general overview of the liver is one of the largest organs in human body. It's actually located in the right side of your body, just on top of the stomach. The things that really fascinate us about liver is that it can regenerate and grow new tissues. We like to call the liver filtering engine of the body because that's what exactly the liver do. The liver tries to filter your body from any harmful material and try to circulate new components that your body needs to survive. So that is something called clotting factors. So then, in addition to the detoxification role of the liver, your liver can also regulate the sugar levels in your body. It also provides you with energy and help you to be in better health and in a better shape, overall. But sometimes, unfortunately, your liver loses the ability to regenerate. And when that
Dr. Ali, sorry to cut you off. I think there's been some comments about your audio. If you maybe try getting a little bit closer.
Sorry about that. Can you hear me now?
Yep.
Is it
Thank
better?
you. Yes, thank you.
Okay, sorry about that. I was just giving a general overview of the liver, where it is in the body, and what's the common functions that the liver shares. And then now we're moving to a conditions where the liver loses its ability to regenerate, and that's called liver cirrhosis. So this is usually due to long-term inflammation or the accumulation of scarring tissue in the liver. And when that happens, it's usually due to long-term inflammation and other conditions like infections, hepatitis B, hepatitis C, some harmful chemicals like the alcohol, and also some genetical conditions that can lead to development of cirrhosis. So it's worth knowing that cirrhosis is not reversible, unfortunately, and usually it can end with a condition called end-stage liver disease or a liver cancer. So overall, the liver cancer or hepatocellular carcinoma have a relatively 5-year survival rate. It's worth noting that it's more common in other regions of the world like sub-Saharan Africa and Asia more than in the US, and that's found due to the other risk factor that is more common in these regions. The American Cancer Society just shared an estimate for primary liver cancers in the year of 2024, and they found that there is around 41 new cases and 29,000 mortality rates. So now we need to think, what are really these risk factors that can lead to the development of liver cancer? I would like to just try and see what you know about this and hear your thoughts. So if you can scan this barcode, I can also copy the code and the link in the chat and just quickly try and see if there is any problem. Please let me know. Can everyone see this? Yes, I can see.
Yep, it's up.
Perfect. Let's be quickly share what everyone is sharing with us. Alcohol, hepatitis C, jaundice, hepatitis, that's good. Substance abuse, genetics, exactly. Smoking. Wow, that's really great, everyone. Thank you. Obesity. Genetics, alcohol. Thank you. Yes, you are absolutely right. So these are among the common risk factors associated with liver cancer. And if we try to organize it into categories, we would say that infections like hepatitis B and C are some of the very common causes of the cirrhosis and liver cancer in some regions of Africa and Asia. Also, other non-alcohol factors can actually lead to liver damage. So, for example, obesity, as someone shared, and metabolic diseases like diabetes can lead to accumulation of fat in the liver, and then this fat can damage your liver cells and lead to the end-stage liver disease and then the liver cancer. You did share genetic there, which is absolutely correct. There's some conditions like a disease called Wilson disease and hemochromatosis where patients have higher rate of developing liver cancer. There is some environmental exposures, like being exposed to something called aflatoxin, which is a type of fungi that is common in some region of Asia. There's also autoimmune disease, and maybe this is the only one that was not shared. But autoimmune disease mean that your body is attacking itself. So maybe your body will attack the liver and lead to this damage. And an example of these autoimmune conditions include primary biliary cholangitis and autoimmune hepatitis. So now let's try and think about the common clinical presentation. What are the signs and symptoms? It's worth to know that liver cancer and liver disease in general can be a very silent disease. Sometimes patient doesn't develop symptoms until the disease is in the advanced stage. And I think it's important to share this to encourage routine checkup and screening. But if the symptoms started to appear, the common symptoms can be some general symptoms like loss of appetite, like weakness, fatigue. You are feeling that you're unable to do the usual daily activities you were able to do. You are noticing that you are sleeping much earlier than normal and waking up later. You can't even stand up from the sitting position easily. You are feeling that you are losing weight without an explanation. Also, there is some specific symptoms like having a pain or swelling in the right area of the body. And sometimes this pain can radiate to your right shoulder or even to the back. If you remember, we said that our liver produces proteins that is important for clotting. Clotting the blood means stopping our blood when there is a bleeding. So you should expect if you have a problem in your liver that you may have a prolonged wound healing and also being easily bruised and bleed for longer time. You may develop something called jaundice. And jaundice means that your skin is yellow, some mucosal membrane is yellow, like your eyes, right at the palm of your hands. You may also notice this discoloration in your urine, having it more dark. Also, some patients may have a very low blood count and overall some fevers and night sweating. I just want to share that symptoms should not just specific to this list. People may come in very different presentation. They may not have any symptoms until the disease is discovered as well. So how can we actually diagnose this disease? Your care team may ask you to have a general blood test just to see your overall wellness and health, and then to see if your liver is working well. So they will send you to something called complete blood count or CBC, and they also will try and see your platelet count on and other specific proteins like albumin and bilirubin. Additionally, they will ask for something called liver function test, and as the name may indicate, this test can show you if your liver is functioning well or not. There's other tests like alpha-fetoprotein. This test usually help to indicate if there is a cancer in your system or not, but it's not very specific. Additionally, there is other tests like imaging tests. So in combination with the blood test, usually doctors will ask some imaging tests like ultrasound, CT scan, and MRI, and this can help in visualizing your liver, trying to see the general condition of it and if there is any abnormal growth or tumors. So also there's other imaging tests that is usually used if we are going to need a staging system, and that's called the bone scans. But we will leave that until the end. Liver cancer usually can be diagnosed using blood test and imaging test. However, sometimes we need an additional step, which is called biopsy. And biopsy is that using small, tiny needle, going there into your liver, cutting small of a piece of the tissue there, and sending that to the lab to examine it and look for any abnormality in that. So there is liver tissue biopsy, and there is something else called transjugular liver biopsy. The latter one can also help us to see if there is any increase in the pressure of the portal veins, which is a vein that is in your liver. So as I mentioned, you may not need to have a biopsy for a diagnosis, but sometimes it's very helpful. Let's say that a diagnosis was reached and there is a liver cancer. We need to know how advanced or early is that. So we need to do something called staging. There are a lot of staging systems available for doctors, and this is not the only staging system, but it's an example of the used staging system. It's called the Barcelona Clinic Liver Cancer Staging. As you may see, it has a stage 0 and then stage A to D. Usually stage 0 is the very early stage. So patient usually have one tumor only, and that tumor is localized in the liver. So there isn't any movement around the liver. There isn't any tumors in the blood vessels or in the nearby organs. And usually this single tumor is less than 2 centimeters. The next stage is still considered early and localized, which is stage A. So you are going to have a single tumor that is less than 3 centimeters or multiple tumors that are less than 3 centimeters as well. You still have a localized condition, so the tumors are in the liver and still not metastating or moving to nearby organs. The next stage here is stage B. This is an intermediate stage, and there is more tumors than was in stage A, and it's also on both sides of the liver. However, if it's still localized and it didn't move outside. This is not the case in stage C. In stage C, the tumor now is in the blood vessels or nearby organs. So that's an advanced stage. You are having some tumors outside the liver. So metastasis could be to the lung or to other organs, stomach, or so on. And the final stage is stage D, when a complete cirrhosis or liver damage is developed, and that's more into the palliative care stage. So usually stage D would only need a liver transplantation. Now that we are mentioning treatment, there are different treatment methods for liver cancer, and it's really important to know that there isn't any one-size-fits-all approach. Every patient is different. Every patient have their own needs, they have their own health and wellness status, and they are in different stage of the liver cancer. So it's important to try and take all of that into consideration into designing more patient-centered treatment plan. But I will just give here a general example of treatment options that are provided for liver cancer patients. One of the treatment options here is surgery. You can remove the tumor, especially if it's in the early stage, and that's called liver resection. And also, if you are in the later stage, as we show in the previous picture, then you may need a liver transplantation surgery, and that's within the option of having surgery. There is also chemomobilization and radiomobilization treatments, and this is using chemotherapy or radiotherapy to target the abnormal liver cancer cells and try to destroy it completely or to slow down their growth. Then there's other methods of therapy like the immunotherapy or targeted drug therapy. They can be used in combination with any of the above treatment options, and it helps your immune system to recognize that there is abnormal cancer cells in your system and that they try to target it and block the blood flow to these liver cancer cells. And finally, it's important to think also about integrative. Alternative medicine and integrative therapy are important to support the health and well-being of patients, and those can include art therapy, dancing therapy, meditation, exercise, relaxation, music, and also others. The last type of treatment that may not be shown here in the slide is also palliative treatment, and that's when you focus on providing support and relief of pain and just try to address the needs of the patient during that stage. Lastly, we can talk about prevention, and I think having better knowledge about the risk factor that can cause liver cancer, this can be the first step to prevent against this condition. So I was really happy to see that many of you were aware of the common risk factors. Overall, having a regular checkup and screening is really essential, but also it's important to maintain a healthy lifestyle. Healthy lifestyle can include healthy diet and good movement, staying active, having more nutrition within your diet, and trying to avoid too much fatty foods or fast food that can lead to some metabolic disorders. Also, avoiding harmful chemicals like smoking and alcohol consumption, and staying up to date with vaccines is really important. It's important to know that hepatitis B have a vaccine, so it's really important for those who are living within communities that have higher chances of having hepatitis B to have vaccination against it. But also, it's important to know that hepatitis C have a cure, and then the sooner you know your condition, and you will be able to start your treatment. So again, screening is essential. That's all I have for today, and I'm happy to take questions at the end of this presentation, but now let me give it to Jessica.
Thank you for that handoff, Dr. Ali. I'm going to also share my slides now, and hopefully everyone should be able to see. And again, like before, please comment. Oops, sorry. Okay, I'm going to share that again. But please go ahead and message if you have any issues with hearing me at any point, and we can navigate that. Okay, so this should be able to share now. All right, now for this portion of today's Fireside Chat, I'll be discussing some of the community outreach initiatives that Somali Health Advisory Committee, or SHAC, as I'll call it from now on, has done to really engage with the community. And as Dr. Ali mentioned, a lot of the things that we heard from preventing liver cancer were related to education and making sure we can promote knowledge of the ways that we can prevent liver cancer. An introduction to SHAC. SHAC is the Guided by Mission, and this is straight from our website and is a mission that we really strive through with all of our initiatives that we do, both through education, research, and community engagement, is to serve as a leading voice and to really advocate for the Somali American community in southeastern Minnesota. We do a lot of events, not only in the Olmsted County, but also thinking more up into the Twin Cities area. And a lot of the outreach that we do addresses topics like liver health broadly, which relates to our Fireside Chat for today, but also touches on other topics such as diabetes, cardiovascular disease, even adolescent health and women's health topics. There's a broad range of things that SHAC tries to advocate, and liver health being a very important component of that. I'm going to go through now and show through some images, things that captured the initiatives that we've done, and one of them being the community health fairs. Now, these are hosted around every quarter or maybe half a year. It ranges, but we've attended various health fairs to have that face-to-face interaction, because a lot of the initiatives that we've done, we found that having that conversation and allowing people in the community to see members of SHAC and to really have that personal conversation about, for example, viral hepatitis screening can really make a difference in building trust and allowing them to really consider more whether or not it's the right decision for them to do. We find out about these health fairs through either word of mouth, or at this point, since we've attended quite a few health fairs, it's becoming a thing that we look forward to in terms of coming, running a table and having these conversations. You'll see this health fair that I have images of here. You can even see the skyline of Bell Tower and the other buildings in Minneapolis here. Really, again, allowing us to come together and have the discussions face to face. And we find that this comprises a decent portion of the work that we do is more of these in person, allowing us to have these intimate interactions with other individuals and have these discussions in smaller settings. But we've also expanded and had larger events as well, and use different avenues such as media as another way to disseminate information, even if we can't physically be in person to be having these conversations. Something that came up a couple of years ago with Shaq was how we could use media and the digital space to share information, especially for clinics that could be showing these videos, but they don't necessarily have the information in Somali to allow them to really show their patients in clinic. And that was something that at Check, we just thought, okay, there's different ways we could be addressing this. We could be creating short, concise videos that discuss certain topics, such as perinatal hepatitis B, which is the video that you see here. I can't tell if you see my cursor, but in this top right image here is a screen grab from one of the short videos that we've done. And you'll see here that they have English subtitles, but we also have these videos in Somali with Somali subtitles as well. And a lot of this demonstrates the need when we're doing our initiatives to be really working with community members and members from the target audience that we're trying to convey the message to. So for example, videos that are made in Somali, we're collaborating with individuals from the Somali communities to be really saying what's the best way for us to be conveying this language and making sure that we're addressing the concerns and myths that people have in the community, for example, about hepatitis screening. We also have done videos, not just through animations, but with people in the clinic and kind of simulating some of those conversations with actors to convey the conversation that can happen between a husband and wife in the clinical setting to decide whether or not they want to do viral hepatitis screening. We've also collaborated recently with clinics in Ghana to convey messaging about a program in Ghana for treatment of hepatitis C. And we've since created and sent out this video that is also now being shown to promote the screening program. We've also found through another avenue is figuring out local TV channels. So the Somali TV has been a very important way for us to continue with our education outreach. And this screen grab that I have here includes some physicians and local leaders really having that discussion about liver health and being able to have that platform for it to be shown on TV and live streamed on Somali Minnesota TV's Facebook page so that we can really reach a broad audience and again, try to bring these health topics in a way that communities would see and would also understand. We also host seminars and workshops that have also allowed us to kind of take a step back and to also have these conversations with healthcare providers who might see a lot of patients in their primary care settings, but they might not know necessarily when they should be referring their patients to a hepatologist for further workup of viral hepatitis and liver cancer. With these seminars and workshops we've had virtually and in incoming in-person events, we're able to really bring these hepatologists and gastroenterologists, so these liver doctors, to really give us their expert opinion and to allow us to have this conversation, especially with these healthcare professionals who have these questions of how can they be culturally responsive in making sure that they're addressing their communities who are disproportionately affected by hepatitis and other liver diseases. Last year's event was virtual, and you'll see a flyer here for that event. with a great amount of attendees. But we also have one coming up, and I wanted to just plug it here in case anyone here was interested in learning more. This year we're doing an in-person forum, and it was largely because of the feedback we got from last year, where a lot of people were saying they wanted to have an in-person event for them to really connect and to have more conversations even after the talks happen, to really understand and understand the network of liver health providers in Minnesota. So we have here the flyers and the QR code that if you were interested in registering or getting more information, we definitely encourage you to scan the QR code with your phone and register. It will be taking place in St. Paul at the neighborhood house on October 26th. And again, in honor of October being the Liver Cancer Awareness Month. And then I wanted to provide information in case anyone wanted to hear more about SHAC. We have more examples of outreach that we've done on our website and are available on social media and through email in case anyone has any questions or any suggestions even for future events that they're interested in. But I really wanted to give that overview because I think what would be very insightful for myself and maybe helpful for the audience today is to have this conversation about methods or questions that you have about community engagement. And so I'll end it here, and I'm curious if anyone has any Q&A, has any questions for me or for Dr. Ali. We can go ahead and answer those.
Now you're muted.
Thank you so much, Dr. Ali and Jessica, for those incredibly insightful presentations. It's clear that both the clinical aspects of liver cancer and the community driven efforts that SHAC is involved in play such a critical role in addressing this important health issue in our state. So thank you so much for all the work and the effort that you both are doing. So as Jessica mentioned, now is time for us to open the floor for Q&A. We have a good chunk of time to dive into some Q&A for Dr. Ali and Jessica. So please submit all your questions using the Q&A feature. And as folks are doing that, of course, as you all know, if you've been to a previous Fireside Chat, it's not a Fireside Chat Q&A without getting our fire started. I'm going to just share my screen. Okay, let's see what's come through. Okay, while folks are submitting their questions, there have been a few questions that have been submitted through the registration form, and this one is specifically actually for you, Dr. Ali. Some folks are interested in, just for you to clarify a little bit more about the symptom difference and understanding the symptom difference between liver cancer and liver diseases.
Of course, yes, that's actually a great question. Usually liver cancer and liver diseases have very similar symptoms. So in general, they only develop later when the condition itself is advanced. But if we think about more specific liver cancer symptoms, it would be having a swelling in your abdomen, like enlargement and fluid accumulation, which is something that can happen in the more advanced stage. Also, we can think of having the very high accumulation of pigments in your skin, or what's called jaundice, as part of this. But overall, I think it's very hard to differentiate liver disease from liver cancer based on symptoms only. And it's really important to have more empirical look where you are checking other aspects and having your blood test and imaging test to support the diagnosis. I hope that answered the question.
Perfect, thank you. And there was one that was submitted. I see that you're typing this question. Dr. Ali, do you want to actually just answer this question?
Yes, actually, I can do that. I think Michelle have a really great question about differences of autoimmune diseases and if another autoimmune disease that is specific to hemolytic condition can impact their liver. And I think it's important to have a conversation with your provider as there is specific biomarkers and tests that can show if that's the condition. But overall, autoimmune diseases are very different. There's a lot of variety and they have a specific target. And it's important to know what type of your autoimmune disease is and if they can actually impact the liver or not. Usually, the autoimmune disease that can specifically lead to liver damage are autoimmune disease that are within the liver itself, like something called Wilson disease or like primary primary cholangitis and so on. So it starts from the liver and the liver is attacking itself. But again, I think it's important to have a conversation with your provider to have like better answer and something that is more specific to your case. I hope that answers that.
Perfect. Thanks, Dr. Ali. So Jessica, this question is specifically to you and the different communities that you serve through your outreach. What roles have you noticed that cultural factors play in liver cancer prevention and education, specifically in some of the high-risk communities in our state?
That is a great question. I think the biggest burden is there's a few, but I can think of off the top of my head that we've experienced through SHAC has been language barriers. So there's a lot of the burden in not being able to understand the health information that a lot of our community members are experiencing is because there's not a lot of resources in their languages. And something that we've noticed a lot, especially when we're working with Somali communities, has been that lack of information in Somali. And that's been a big reason for some of that disconnect with individuals not really understanding fully what their diagnosis is or understanding the guidelines is because they're not getting it in their language, and then it doesn't feel like the material really relates to them. And that is a big barrier that we're trying to help and work through. But I also do think there's been more acknowledgement of the need to be translating more material, so that has been helpful, but certainly a lot of gaps still. And the other thing that I've noticed has been that depending on the different groups that we've worked with, there could be a lot of mistrust and in feeling a bit hesitant because of own cultural practices about whether or not people should be getting screened or whether or not certain traditions that people are doing in their communities are putting them at risk for viral hepatitis, for example. And it's been a part of our education to give the information. So for example, in our hepatitis C video, something that we do mention is the impact of scarification, which is a practice in certain cultures, but does pose a risk, for example, of wound infection and contamination, and especially with the contamination of blood of contracting hepatitis C. And that's been something that, for example, we have to really do very culturally sensitively to bring up, but to kind of bridge that gap between practices that are really tradition, but making sure we're also bringing that awareness, though, that there are going to be some risks with it, and making sure that we are making that information accessible.
Thank you for that, Jessica. And there's another question that just came in now, and this one, Dr. Ali, I'll ask you. Is liver cancer similar to pancreatic cancer in that it's not often discovered until it's at the advanced stage? Because it seems there's no, as we know, early detection screening tool that's out there that is covered by insurance.
So I can't really speak about insurance part as I'm not currently practicing medicine here in the US. However, I think there is a lot of screening tools available, and simply by ultrasound and blood test, if there is some high-risk patients who we already know that have, for example, hepatitis B or C, or they are having more risk of developing non-alcohol related liver damage due to accumulation of fatty tissues in their body, then of course the doctor will try to schedule a regular follow-up, and that regular follow-up can be with imaging tests and blood tests, as I shared. So I think in general there is really good screening tool for liver cancer in general, but it is actually close to liver to the pancreatic cancer in the form that sometimes it's symptomatic only in the advanced disease.
Thank you for that. Keep your questions coming, folks. Now is your opportunity. So, Jessica, I'll ask you this question. So how have you been able to handle, or I guess kind of overcome stigma when you're doing community engagement in terms of hepatitis screening and liver cancer prevention?
I would say something that we found very helpful has been making sure that we're having the conversations again with the communities that we're trying to address the stigma for. So, for example, I'm thinking back to the video that we did where we had a Somali couple who are actors in the clinical setting, where they're really addressing some of those topics through their conversation. And what we were trying to do with it was, after discussing with members of the Somali community about what were some topics that we could mention, we then decided, well, how can we make this relatable, and to make it seem not as like taboo to even talk about. And what we thought about then was, why don't we make it a conversation between a couple in the clinic when they're just having a conversation with each other after hearing what the doctor said. And by doing it in that way, it really creates an environment where people watching the video will say, that's a topic that I could really see myself having with my partner, and it doesn't have to feel like it's inappropriate to be talking about. And we can really kind of allow them to have that ability to see that unfold on a short video that they can then kind of share with other family members too, and say, like, look, there are people who look like us who are having conversations about getting screened for hepatitis, which I didn't really feel comfortable bringing up, but I think it kind of applies to us. So I think that's one way for sure. And again, a lot of that really does involve us being cautious about not just making these videos and having people not look representative of the individuals we're trying to target.
I think I just want to add one point to what Jessica said. It's also organizing activities that is targeting healthcare providers as well, because it's also important to raise the awareness about the community need and have more cultural humility within our providers. And I think that's can cover through the workshops and the talking forums that we are providing, where we are trying to expose providers to different perspectives and try and understand what is the specific need of the community.
Great point. Thank you for adding that, Dr. Adi. So this question actually is for you, Dr. Adi. What are the disparities that we see in liver cancer rates?
There is different layers of disparities in liver cancer disease, and one of the common theme is the disparities in access to health services. So in some communities where there is higher prevalence of hepatitis B and C, there is lack of effective channels of testing and being connected to health system, where we do see those patients in advanced stage when they already developed liver cancer. And it's important because now, with all the advancements in treatment, we know that we can cure hepatitis C with a treatment. So it's really essential to have this screening available. But also there is this layer of language barrier that Jessica mentioned, it's important to acknowledge that we do need a patient-centered approach where we feel like there is a safe communication channel where we can provide cultural-specific, language-specific materials that can raise the awareness within those communities that have higher risk of developing the disease. And the final disparity, I would say, is that disparity within the scientific body. I couldn't see much papers and studies that is targeting specifically the presentation in specific communities in Africa, per se, where we see that they tend to develop liver cancer in very early age compared to other ethnicities or race, where they may develop it later at the age of 80. And we see some patients develop here at the age of 40, for example. So I think we need to raise the awareness about more involvement in effective trials and studies that can target the need of these communities and hopefully try to generate evidence that can help us inform the policy and our practice into having more equitable services.
Perfect. And there's kind of a follow-up question on that. Where can someone find more information on liver cancer rates by ethnicity?
I think there is some information available through NIH and through other national databases. I can happily share the links with you, Amna, and then you can disseminate it to all participants.
Perfect. Yes, we can definitely do that in our the follow-up email that we send out tomorrow. So your links as well as your presentations will include in that email. Okay, again, keep your questions coming. We still have some time. So this question I will ask you, Jessica. So tell me a little bit more about some of the collaborations and the partnerships that you've been able to form and what has been most effective. I know you talked a little bit more about some of the engagement strategies that you're involved in, but what has been the most effective in reaching the underserved communities for liver cancer awareness?
Certainly, we've had a lot of collaborations through the years. Some of them were formed just by first hearing about an event, tabling, and then really from there being invited to come back year after year, which I think speaks towards them understanding that we have this interest in attending community events, so like those community health fairs. I think other things that have really formed through the year has been just through SHAC and through that collaboration between University of Minnesota and Mayo. We've really engaged a lot of providers at both institutions to form a liver health consortium of just researchers, advocates, and physicians who all are meeting once every month or every 2 months to talk about initiatives or different events that we could be forming, especially between Rochester and in the Twin Cities in between. So that's been very helpful. And has contributed to the in-person forum that we're planning later this month. I think in terms of like what's been the most meaningful has been really thinking of creative ways to be present at different community events. I'm thinking towards some of the events that members of SHAC have done where they've gone in between prayer to host community education talks on screenings and just wellness topics overall. And again, like thinking about like creatively, where can you show up and be present, and to think about that face-to-face interaction, but then also understanding that you now have this network of physicians and researchers and advocates who are now part of this team. And how can you then use them to say, I'd like to do this talk, and now we have the individuals that we could be inviting. And so just kind of bringing that face-to-face community interactions together with that network of experts to really leverage bringing the experts to convey their educational materials to the audience.
I love that you've been able to form this consortium. It's wonderful to hear. So Dr. Ali, this question is for you. Are liver transplants common? And are organizations like Be the Match a source for people who want to be a liver donor?
Oh, thank you for that question. Actually, yes, there is needing liver transplantation as a source of treatment is common sometimes, especially with advanced stages of end-stage liver disease or cirrhosis. But I didn't actually catch the second part of the question about Be the Voice. I'm not really aware of this community per se.
Are there any organizations that folks can connect with if they're interested in
There is
being
more,
a donor?
yeah, I think for my knowledge so far, as I'm really not also from here, I'm being international physician or who recently transit here. I think the resources that I'm aware of so far is resources within Mayo Clinic. For example, there is patient support resources that is for liver transplantation. Patients who are referred, resources that can answer this question about what will happen before, during, and after the transplantation. But also there is additional resources within that page. So I will happily share that with you, Amna, as well.
Okay, thank you for that. So we'll have just one more question that I'll ask both of you before we conclude with our Q&A today. So what is one key message that you, from the conversation today, that you want our audience to know? Jessica, do you want to start?
Yeah, I'll start. I would say the key message that I want to say from the outreach side of things is to really, if I guess with the audience, if anyone has that idea or feels that you're interested in participating in that advocacy, just know that there are so much interest. There's so much interest, especially now in Minnesota, with increasing liver health, liver cancer outreach. So find those communities and really reach out, because your ideas could really be the next thing that, for example, SHAC, we would love to hear ideas that people have and to really make them come to life, especially if it's something that you've noticed in the community has been a burden and has stopped you from, for example, going to get screened or asking your provider about something that because you felt you just didn't really have that information.
Thanks, Jessica. Dr. Ali?
Yes, I think I would just share that you are the one who know your body the best. I mean, you know your health, you know your wellness. And if you feel anything is wrong, don't be afraid to speak up and ask for guidance and ask for specific needs to be addressed. And I think that would be the advice I would give, like just be conscious about your own self and be like able to speak up for your needs and advocate for yourself.
I think that's a wonderful way for us to conclude our fireside chat today. So thank you everyone for the thoughtful questions, for your engagement, and a special thank you to you, Dr. Ali and Jessica, for your insightful presentations and for helping us raise awareness about liver cancer risk factors, prevention, and the incredible community-driven outreach initiatives that you both are involved in. So as we wrap up, we'd really appreciate your feedback on today's fireside chat. So when the session ends, a brief survey will auto-populate on your screen, and your input, please complete it, because your input is extremely invaluable and helps us improve our offerings. And after you complete the survey, stay on the page, because there is a link to enter the drawing to win a prize pack filled with goodies from the Masonic Cancer Center. And also the survey link, as well as both Dr. Ali and Jessica's presentation and some of the additional resources that were mentioned, will be included in the follow-up email that will be sent out tomorrow. And also I want to invite everyone on this call to join or attend our Cancer Free Future, the community conference on cancer prevention on Saturday, November 2nd at the university's Urban Research and Outreach Engagement Center in Minneapolis. So it's a free conference that's open to the public, and that will focus on cancer prevention, early detection, and also strategies for building healthier communities. And there's also going to be screening opportunities on site. You can register and learn more in the link that was provided in the chat earlier, but we'll also send it in the follow-up email tomorrow. And also hope to see you all on October 26th at the Liver Health Forum that SHAC is hosting. Again, we'll include the registration form in the email that will go out tomorrow. And then lastly, mark your calendar for our Fireside Chat next month on November 20th at 1 p.m. We'll cover lung cancer risk factors in honor of Lung Cancer Awareness Month in November, and details will be posted on the Fireside Chat website soon here. So follow the Masonic Cancer Center on all of our social media platforms just to stay up to date on our future events and announcements from the Office of Community Outreach and Engagement. Thank you again, everyone, for joining us today. Hope you all have a wonderful rest of your day. Take care.